I had a Center for Brain Health elective rotation, and I really loved working with those folks. A lot of those folks had memory concerns like Alzheimer's or dementia, and I kind of fell in love with neurology through that. So I am part of the Center for Neurologic Restoration within the neurology department. And most of the patients that we see are Parkinson's patients, essential tremor patients, and I actually have a special interest in functional movement disorder patients as well. It's a relatively new, newly understood neurologic condition, and the Cleveland Clinic is one of the biggest centers for multidisciplinary care for functional movement disorder. Functional movement disorders are, simply put, a miscommunication between brain and body, and they can cause a variety of really disabling symptoms like tremor, weakness, stroke-like symptoms. They can also cause different symptoms of the voice or cognition. My goal is to learn what those symptoms are for functional movement disorder patients, and then learn how do we improve where we're at right now. Most patients that come to me have been diagnosed with functional movement disorder already. I get to know those patients on a one-to-one basis and really dig in and figure out what kind of goals they have for their symptoms. So oftentimes we work with specialized physical therapists, occupational therapists, speech therapists, and psychologists. I've seen my team work together and approach that patient as a real person and as a whole person, and actually be able to accomplish these huge goals that our patients have. Actually seeing the progress over a span of time, whether that be, at a 3-month visit or 6-month visit, that's why I got into medicine in the first place. With me as your provider, you can expect to be listened to. I think that listening is one of the most important skills that a provider can have. Outside of work, I really love to cook. My mom is a really great pie baker, so she taught me how to bake pies. So the two of us bake pies together.